Hi everyone, my name is Bob Doane and I own the Acupuncture and Wellness Center in Paulsbo, Washington. We are one of the largest Chinese medical clinics in the United States, and we routinely see anywhere from 60, 70, sometimes 100 people a day. And we've been in business for over 22 years, and one of the things that we commonly treat is the complaint of fatigue. And in Chinese medicine, it might be interesting to talk about fatigue and how we determine what's causing it or what we feel is causing the problem. In Chinese medicine, fatigue can fall into two large categories. Either the patient has an excess problem or they have a deficient problem. If they have an excess problem, it's that they have either too much dampness or water in the body, they have too much heat or inflammation in the body, or they have a restriction of blood flow in the body, which we call blood stasis. Or they can have a combination of all three. In other words, they can have stagnant blood, excess dampness, and excess heat. We use Chinese herbs, herbal medicine, and we use acupuncture to clear out the dampness, clear out the heat, and move the blood. The result is the fatigue gets dramatically better. If the patient falls into the camp of deficiency, the deficiency generally falls into several organ categories. They can have deficiency of lung functioning, deficiency of heart functioning, deficiency of liver functioning, and deficiency of kidney functioning. Now, in Western medicine, a deficient kidney closely resembles an adrenal insufficiency. A liver deficiency is simply the same thing. It's an under-functioning liver, same with the heart. But in Chinese medicine, when we say the lung is deficient, lung in Chinese medicine is somewhat sophisticated. It's a combination of the upper sensory organ system, the thyroid gland, and the lung itself. So you have the lung, the functioning of the thyroid, and the whole sinus, the functioning of the sinuses themselves. All of that combined together comes into the category of lung in Chinese medicine. And again, Chinese herbal medicine and acupuncture is applied to strengthen, or what we call tonify, the lung, the heart, the liver, and the kidney. How can we tell if the patient has an excess condition or a deficient condition? From the radial pulse. The radial pulse very clearly delineates if the patient is in the excess category problem causing their fatigue, or the deficient category problem causing their fatigue. If the pulse is strong and pounding all around the wrist at the radial artery, then for sure it's an excess problem. If the pulse is very thin and weak around the wrist, along the radial artery, then the problem is a deficiency pattern. And Chinese medicine has been treating these kinds of fatigue complaints for 2,000 years. And it's for this reason why the medicine has survived all 2,000 years, because the treatments are very, very effective. And it's for this reason of effectiveness that's contributed to the longevity of traditional Chinese medicine. Have a great day. Bye-bye now.